So now we are moving for our part 2 video. So till now we have completed of lung. Okay, part 2 video of lung. So till now we have completed the introduction, external features and relations in detail, right? Now that actually the topic will be the root of lung. First I will finish it off the fissures and lobes, then I will go for the root of the lung. Okay, for knowing the fissures and the lobes, first there are two fissures. Okay, one is oblique fissure. Okay, so oblique fissure, and the second one will be the horizontal fissure. So these are the two fissures that is present in our lung. Okay, so what because I'll tell you. So first let us consider the right lung. Okay, so this is the right lung. Okay, this is the right lung and this will be the left lung. Okay, so right and the left lung. Okay, now there are two fissures I told you. Okay, one is oblique fissure and the horizontal fissure. Now I will come from here, then I will draw here. So what is this lung? Will be the right lung, lateral surface, and this one will be the left lung. Okay, so consider this is our right lung. Okay, right lung. So here this we know that this surface will be the medial surface, anterior border, right? So there is the oblique fissure. The oblique fissure I'll see. So this one will be the medial surface, right? This one will be the medial surface, anterior border, posterior border, and this one will be the lateral surface, right? So now oblique fissure starts from the medial surface. Okay, cuts the posterior border. Just 6 centimeter below the apex. Okay, it starts from the medial surface, cuts the posterior border 6 centimeter below the apex, then it runs downwards and forwards. Okay, it runs downwards and forwards and reaches the inferior border just 7 centimeters lateral. Okay, 7 centimeters lateral to the anterior border. Okay, or 7.5 centimeters. Okay, 7.5 centimeters lateral to the midline or the anterior border, from the anterior border. I repeat, see here. So the oblique fissure starts from the medial surface, cuts the posterior border 6 centimeter below the apex, then it runs downwards and forwards and it reaches the inferior border just 7.5 centimeters lateral to the midline. Okay, so now that I can draw this like, so 6 centimeters, so this is posterior border, right? So 6 centimeter below the posterior border and it runs downwards and forwards and it cuts the inferior border. Okay, it cuts the inferior border just 7 centimeters. Okay, so 7 centimeters from the anterior border. So this should be the 7 centimeters from the border. Okay, so here also the oblique fissure 6 centimeters, but here what is the difference means it will reach throughout towards here. Okay, so just close to the midline. Okay, so it reaches close to the midline, but in case of right lung the oblique fissure will be 7 centimeters from the midline. Okay, so now the next fissure is that the horizontal fissure, right? So the horizontal fissure is the one. Okay, horizontal, so we know that this is the anterior, but horizontal fissure, and here will be the, here whatever here running will be the oblique fissure, right? The horizontal fissure that starts from, okay, before that I want to clarify one point. The oblique fissure divides the superior and the middle lobe from the inferior lobe in case of right lung. Superior lobe, middle lobe from the inferior lobe. In case of left lung, it separates the superior lobe from the inferior lobe. Okay, so there will be one more fissure, I will tell you. Okay, so this is the, so we know that the oblique fissure will be coming like this. The horizontal fissure starts from the anterior border at the level of fourth rib, okay, and it traverses backwards, okay, and it joins the what fissure? Oblique fissure at the mid-axillary line at the level of fifth rib, okay. It starts from the fourth rib, it travels backwards and it meets the oblique fissure at the level of fifth rib in the mid-axillary line. Okay, mid-axillary line. So, it starts from the fourth rib, okay, and it travels backwards and it meets in this mid-axillary oblique fissure, okay, at the mid-axillary line. Okay, so this will be the oblique fissure and this one will be the horizontal fissure. Sorry. This one will be the horizontal fissure and this one will be the oblique fissure, right? So, this one will be the oblique fissure and this one will be the horizontal fissure. But in case of left lung, only there will be the oblique fissure. So, there won't be any horizontal fissure in the case of left lung. Okay. So, what happens? So, the right lung has the upper lobe, okay, middle lobe and the inferior lobe. But in case of left lung, we have upper lobe and we have the lower lobe. There is no middle lobe in case of left lung, okay. But in case of right lung, there is horizontal fissure that divides the upper half into upper lobe as well as the middle lobe, okay. So, the oblique fissure of the right lung divides the upper and the middle lobe from the inferior lobe, but in case of left lung, the oblique fissure divides the upper lobe from the lower lobe, okay. That is the difference in the fissure, okay. So, the important point to notice, this is from the 6 centimeter from the apex and this is about the 7 centimeter from here, okay. This is the fourth rib and meets at the mid-axillary line at the level of fifth rib, okay. But here the oblique fissure will be towards the end, okay, towards the anterior border. That is the thing you have to note. We will go for the root of the lung, okay. So, what is the root of lung? The root of lung, so fissures are over. So, we have completed the introduction, external features with the fissures. Next, we are going for the root of lung. If you see the root of lung, what is root of lung? Root of lung is a, listen carefully, it's a short, broad pedicle, okay, it's a short, broad pedicle that connects the medial surface of the lung with the structures in the mediastinum, okay. So, in this case, so this is the lung anterior border. So, here will be the right lung, no? Here will be the mediastinum. So, a short pedicle, short broad pedicle that connects the medial surface or mediastinal surface, whatever, mediastinal surface of the lung with the structures in the mediastinum, that is mainly the heart and the trachea, okay. So, what are the structures, that constitute the pedicle? We will see that, okay. So, root of the lung. So, in the root of the lung, the structures present in the root of lung, okay. So, the root of lung, the structures present are, okay. So, this is first one. First, we have the trachea. Okay, so trachea divides into two bronchi. Okay, that is called as principal bronchi. Principal bronchus that connects the lung with the trachea. So, the first structure that I can write here are the principal bronchus are the primary bronchus, right? Okay, so what is the function of the primary bronchus? It connects the trachea with the lung. Okay, next structure I can write is the pulmonary artery. Okay, what is the next structure is the pulmonary artery. There are two pulmonary artery that comes from the heart, okay, as a pulmonary trunk and divides into two pulmonary artery that carries deoxygenated blood to the heart. Deoxygenated blood from the heart to the lung for purification. Okay, so that is about the pulmonary artery that carries deoxygenated blood from the heart to the lung for the purification. Next, we will go for the pulmonary vein. Pulmonary vein, totally 4 in number but 2 for each lung, 2 for each lung. Okay, what is the function of the pulmonary vein? The pulmonary vein, after purification from the lungs, the oxygenated blood from the lungs will be carried to the heart by means of pulmonary vein. So, the pulmonary vein connects, two in number for each lung, that connects the lung with the heart. Okay. So, next one will be the bronchial artery. Okay. So, the bronchial artery that carries oxygenated blood to the bronchial tree present in the lung. Okay, that carries oxygenated blood from the heart. Okay, oxygenated blood from the heart to the this one. Okay, next one will be the bronchial vein. Okay, that brings the deoxygenated blood from the lung and empties into the heart. Okay, so principal bronchus, pulmonary artery. So bronchial artery gives oxygenated blood for the bronchial tree, and the deoxygenated blood from the bronchial tree will be collected by the bronchial vein. Okay, next one will be the nerves, that is the anterior and the posterior pulmonary plexus. Okay, anterior and the posterior pulmonary plexus that connects the that is present, that also present in the root of the lung. Okay, and finally the next thing will be the lymph nodes. Okay, so lymph nodes that is also present in the pedicles. Okay, that is present in the pedicle. So, these are the structures that are present in the root of the lung. Okay, so the root of the lung is nothing but it is a short, broad pedicle that connects the structures of the lung, connects the lung with the structures in the mediastinum. Okay, so the principal constituents that in the pedicle are the principal bronchus, pulmonary artery, pulmonary vein, bronchial artery, bronchial vein, anterior and posterior pulmonary plexus with and the lymph node presence. Okay, now you should know what is, so now the root of lung, you know that the structure connects the heart with the lung with the mediastinal structures. Then what is mean by hilum? Next question is, what is mean by hilum? Hilum. So there is a small difference between the root and the hilum. So this broad structure that is called as pedicle. That pedicle will enter in some opening present on the medial surface of the lung, right? Suppose the pulmonary artery also, it has to enter into the lung, pulmonary vein also. So the medial surface of the lung will have a area that is called as hilum, where the structures present in the hilum will enter or exit the lung. Okay, they will either enter or exit the lung, that is present, that the opening present on the medial surface of the lung. Okay, that constitutes the hilum, where the structures enter or exits the lung. Okay, now I will draw you the hilum. Okay. So, this is the hilum of the right lung, right? And this is the hilum of the left lung. Okay. So, the right lung hilum and this is the left lung. Hilum, right lung, and this is the left lung. Okay, if we speak about the hilum right and the left lung, then we have to see that what are the openings present in it. Okay, so for the seeing the openings present in it, so there will be the pulmonary veins, right? So the pulmonary veins will be the superior pulmonary vein. I told you, no, 2 for each number. Inferior pulmonary vein. Okay, so superior and the inferior pulmonary vein. Here also we have the superior pulmonary vein and the inferior pulmonary vein, right? Then we have one pulmonary artery, right? So, and we have one principal bronchus, right? So now I will draw the pulmonary artery. Okay. This is the pulmonary artery, and here also there will be the pulmonary artery. Okay. Now, there will be the bronchus. Okay. So, what is the bronchus? We have in right lung, we have the principal bronchus it divides into epartrial and the hypoarterial bronchus. So, epartrial bronchus will be above the pulmonary artery and the hypoarterial bronchus will be below the pulmonary artery. Here only one bronchus, that is the principal bronchus. Okay, and we have, in addition to that, we have the bronchial veins, bronchial vessels. Okay, we have the bronchial vessels with the nerve plexus. Okay, we have the nerve plexus. Okay, so now we can name it like this are the pulmonary veins. Pulmonary veins, right? And these are the this is the epiarterial bronchus. Okay, this one will be the hypoarterial bronchus. Hypoarterial bronchus, and this one will be the pulmonary vein. Okay, and here this will be the pulmonary artery. Here also this is the pulmonary artery, sorry. Okay, and this one will be the pulmonary vein. This one will be the bronchus, principal bronchus. And these are the bronchial vessels and the nerve plexus, right? So these are the structures that constitutes the hilum. So the hilum is the area that is present on the medial surface of the lung, where these structures entry or exit the lung. Okay, now we will see the relations of the root of the lung. Okay, so we have completed. Now we know what is root of lung, what is hilum of the lung. We know the difference. Root means the connecting structure, that is the pedicle. Hilum is the opening present on the medial surface of the lung. Now, what is related to the root of the lung? So that we will see what is the anterior relation, what will be the posterior, what is the superior relation, and what is the inferior relation of the root of lung. Okay, for that we will see about the relations of the superior okay. Now the superior, right? So I'll use this. Okay, so what is related to the anterior relation of the root of lung? So anteriorly, the both sides, the root of the lung will be related to the anterior pulmonary plexus. Anterior pulmonary plexus, right? Posteriorly, it is related to the posterior pulmonary plexus. Posterior pulmonary plexus. Okay, now I have to add this anterior and posterior. This is common. This anterior pulmonary plexus and posterior pulmonary plexus is common for both, anterior relation for both right and the left lung. But in addition, anterior lung, okay, anterior relation of the root of right lung will have the vena cava, superior vena cava in front of it. Additionally, the posterior, this superior vena cava will be present only in the right side. Okay, but in posteriorly, extra structure that is present to the posterior that forms the posterior relation of the root of left lung will be the descending thoracic aorta. Descending thoracic aorta, that will be present only in the case of left lung. Okay, see, this root is very, very important. Root is of the lung is important 5-mark question. Okay, so anterior as well as posterior, common for both lungs will be the anterior pulmonary plexus and posterior pulmonary plexus. In addition, anterior relation will be the anterior relation of the right root of lung will be the superior vena cava, and the posterior relation of the left root of lung will be the descending thoracic aorta. Okay, so now superior relation and the inferior relation. Okay, the superiorly we know already, the superior I have shown in that only, the superiorly the root of lung. Okay, that will be winded by the right side. Okay, superiorly the root of lung will be winded by, okay, so right side it is winded by the azygos vein on the right side, and in the left side by the arch of aorta. We have already seen in the medial surface, okay, in the medial surface relation we have seen in the left side it will be the root of lung will be arched by the arch of aorta, but in case of right side by the azygos vein. And finally, the inferior relation of both the lungs will be the pulmonary ligament. Anyway, the pulmonary ligament we have discussed in detail in the pleura class. Okay, so inferiorly it is related to the pulmonary ligament. So these are the relations. So once the question is the root of the lung, you should write about the what is root of lung, what is the difference between the root and the hilum, and what are the structures present in the root, and what is the relations of the root. Okay, so all the structures, all this thing you should be writing in the root of the lung.